In your experience, in terms of hormone balancing, what do you find your patients get from that in terms of benefits? Is it just a quality of life? Can people actually live longer if they do that? I mean, what do you find?
Yeah, there's going to be a lot of obvious physical changes. For example, a woman coming in that is low on estrogen, progesterone, she's going to have saggier skin, saggier breasts. She's going to have decreased libido. She's going to have just loss of zest. She's going to be that typical 55-year-old female who's like, I'm not 30 anymore. The cool thing is with balancing out these hormones, one, it's done very scientifically. It's not just like, I think you need a little bit of that, let's just check and see what happens. We actually will check that level, optimize it, recheck it again. We're doing everything to make sure we're not putting her at higher risk of chronic disease. So she's going to look better, she's going to feel better, her skin's going to tighten up a little bit, she's going to have an increased energy, maybe increased libido. It's going to help with her bone density, so it's going to decrease her risk of chronic osteoporotic fractures. If you balance out the progesterone, it's going to decrease the risk of breast cancer. So there's a lot of things that are seen with it, which are great. They're going to feel better, have more energy, look great, but there's a lot of probably more important subtle benefits that are unseen.
Are there risks at all with that?
With anything, there's always a risk. You have to risk. Okay, is it riskier for me to not take something, or is it riskier for me to take it? With bioidentical type hormones, again, we're optimizing the body to the body's physiology, to what the body needs to function. As with anything, if I took too much vitamin D, it's going to get toxic. If I took too much, certain other supplements, too much fish oil, my blood's going to get too thin. I could bleed out. So everything has to be optimized based on science, physiology, and research. And so with that, you have to balance, is it safer for me to do something, or is it safer for me not to do something and have that risk of the cancer and being overweight and having the problems as well?